Hi there, I'm Dr. Natanya Wachtel, and welcome to Mindful Moments. I've spent years as a therapist and advocate helping patients, families, and care teams support overall well being and support skill building for betterment. I'm here to connect with you for a few moments each week to support your mental well being as a caregiver. The purpose of the Mindful Moment is to help you start with a pause and take a deep breath, and to move beyond busy and worry mode into a more relaxed mode where you can feel a sense of calm and peace, and most importantly, strength. So let's get started. We'll begin today as we have before, taking several long, full, deep breaths into the body. We're going to notice any place of tightness and tension and try to relax, starting from the top of your head, through the forehead, down through the face, neck, shoulders, torso, legs, and even into the feet. Are you ready? If you can, close your eyes or have a soft gaze. One more. Now, take a moment to notice what is here for you. What are you thankful for right now? Label it for yourself in your mind in just a few words. Now that we're feeling a sense of calm, let's talk about what we need to go forward, moving through some barriers when asking for help. Last time we spoke about some barriers, and today we're going to go one step further and talking about that help team, that teamwork that you need. As many of you know, teamwork is essential to caregiving. Do you have a team of people that you can trust to support you in your caregiving responsibilities? Or are you shouldering it all on your own? In addition to the person in need, the care team can include family, friends, doctors, social workers, and therapists, or others whom you may trust. Now, it may seem obvious to need a team, but it might not be obvious in how to gain support and what kinds of support you need from your team, especially those outside of the doctor or hospital. This can bring us to think about rights. And when we think of patient and caregiver rights, we may think about things like the right to be included in caregiving making decisions, or the right to be included in hospital discharge planning or medical treatments, or the right to be trained in how to provide necessary care, or the right to learn about a person's condition and prognosis. But did you know that as a caregiver, you not only have those rights, but the right to ask for help and the right to set limits? This can be especially difficult with friends and family. But friends and family may be the best to help with care. If your family tackles issues as a team, you may be ahead of the game. But even close families can be tested when one of you needs care. Perhaps you can try to plan a meeting. Before the meeting, you can prepare to talk about medical care, the daily needs and living arrangements, and even how to pay for care. Most importantly, you can talk about dividing the caregiving tasks. One of the ways to do this is to think about ways you might use each other's strengths so you can make specific requests of people versus just saying, I need help. Not sure where to start? Review your list of caregiving tasks. Which tasks could others help you with? Finding the conversation difficult? Well, here are some tips for those difficult conversations. The first is to know your purpose. Be clear on what you want to accomplish. The second is to listen. Allow everyone to share their concerns and express their feelings. The third is to take your time. Leave room to continue the conversation at a later time, especially if it gets a bit heated. Next, you want to consider maybe spending some more time together beyond the conversation so that there can be some time planned to help everyone stay connected. You also want to plan ahead for your meeting and figure out what you're going to say ahead of time. Next, you want to be clear that you state the issue and share the purpose of the conversation and why it's important to you and everyone, especially the person who needs care. And lastly, when you wrap up, make sure to thank everyone for their time, attention, and support. Remember, teamwork makes caregiving work. With love and gratitude, I'm Dr. Natanya Wachtel, and this is a mindful moment.